Right button. Right button.
Good afternoon.
Good afternoon.
This public hearing is now called to order. Today is Thursday, January 22, 2015, and the time is approximately 2 p.m. For the record, it is 2:12 p.m. This is a public hearing on a proposal to amend Articles 205 and 207 of the New York City Health Code. What are we proposing? The New York City Department of Health and Mental Hygiene is proposing that the Board of Health amend Section 205.03 of Article 205 of the New York City Health Code to increase the number of users who are required to submit electronic death records. In addition, the department is proposing that the board amend Section 207.13 of Article 207 of the Health Code to eliminate the fees charged for interim disposition permits and for correcting a final disposition as a result of an interim disposition. I am Harminder Pal Singh Rana, Assistant General Counsel of the New York City Department of Health and Mental Hygiene. Also here today is Stephen Schwartz, Assistant Commissioner of the Office of Bureau of Vital Records, and Svetlana Burdanik, Assistant to the Secretary to the Board of Health. The purpose of today's hearing is to elicit public comments and information to assist the Board of Health in determining whether to adopt this proposal. A notice of public hearing and opportunity to comment on proposed rules concerning this proposal was published in the City Record on December 12, 2014. A copy of the first page of the notice of public hearing has been provided to the stenographer taking notes to include in the record. Persons wishing to speak at this public hearing were asked to pre-register. One person has pre-registered to speak today, and I will call that person now to speak. Generally, the speakers are afforded 5 minutes to present their comments. And that person who has registered to speak, and forgive me if I mispronounce your name, sir, Robert Ruggiero.
Thank you.
The Executive Director of Metropolitan Funeral Directors Association. Mr. Ruggiero, you are now.
Thank you, Mr. Rana. And I want to thank the committee for inviting us here. And
Red button. Make it right there.
that way? Okay. Thank you, Mr. Rana, and I appreciate being invited to the hearing. My name is Robert Ruggiero. As you mentioned, I'm the Executive Director of the Metropolitan Funeral Directors Association of New York City. We represent 127 funeral firms and employ about 700 individuals in and around the New York City area. And not to overwhelm the committee with the same repetitious comments, they've appointed me as spokesperson for the industry, and joining me today is our current president, John D'Arienzo, President-elect Peter DeLuca, past President Anthony Martino, board member Henry Gutterman, and we're here, and my assistant Tina Ruggiero, and we're here representing the entire group. We spoke in advance and we felt it's just simpler for me to speak. In terms of Section 207, where Dr. Schwartz is asking for the elimination of the fees using the interim permits in relation to the funeral homes, and the correction affidavit that needs to be filed along with the interim permit, we're in total support of that. We understand the health department's necessity to track human remains. We had no idea that the general public reaches out to the health department when a loved one passes, but they haven't had constant contact with them, and they reach out to the Department of Health, and the department, under the present system, doesn't have the ability to properly track whether remains are located on a daily basis. So we're in full support of the use of the interim permit, and we would appreciate it if those fees for the use of that permit would be waived. What we take objection to and we ask that that be reconsidered, is the other section, 205, which refers to the number of people that are going to be required to mandatorily use the electronic death registration system. Presently, it's 25. The health department is asking the number to be lowered to 10, which would bring the number of participants higher. We would like that number to go to 0. We feel that the committee has the ability right now to mandate that the usage of this system be mandatory on all parts. And we have some reasons behind it. First of all, I was part of the advisory board committee that was appointed by the city council for the first EDRS system. And the Metropolitan Funeral Directors not only assisted Dr. Schwartz in the implementation of the first system, we helped get it out in the street, we helped train our people in the proper usage. We also took it upon ourselves to try to train private physicians in their private practice to utilize the system, and we've met some resistance along the way over the course of a few years. We are asking the committee to make this mandatory because this did not come last Tuesday morning when Dr. Schwartz decided that we were going to change things. EDRS was in a 5-year plus development stage, and it's been out in the public usage now for well over 5 years. Given the medical industry anywhere from 10 to 12-year window for them to accept the concept that this EDRS program is out there and needs to be used, they're just belligerently not using the system. Our board members, our regular members, constantly interact with these private physicians, and we bring them the biometric device. We try to coax them into using the system, and they arrogantly tell us until that law states that they need to use that system, I'm not wasting my time. It's up to you guys to bring us the paper documents and have us sign them. So that's just generally the resistance that we're getting, which I don't understand because physicians now, the state mandated that they use iStop for issuing regulated prescriptions. They have to electronically send the prescription to the pharmacy, the providing pharmacy, and the iStop system is supposed to stop the issuance of fraudulent prescriptions. The other reason being that a lot of these physicians are already enrolled in EDRS through a medical institution but refuse to bring their private practice on board simply because the nurse in the office doesn't want to do it, or a clerk doesn't feel like it's his responsibility to learn the program. Until we make this thing mandatory, where they have to use the system, objectionably deciding whether or not they're going to use the system is just working against us. We also have a situation where this is an industry where they're close-knit people and we speak to each other. Anecdotal stories about walking in the office and not finding the doctor present, but yet the certificate manages to come from the back office. Certificates being left in the drawer, pre-signed before the individual passes. Another individual walked past the doctor on his way out the door after just receiving the death certificate and walked right past the doctor he was supposed to be seeing to have the certificate signed because the clerks stop us at the gate. At the office, they tell us, I have a seat, give me the document, I'll bring it to the doctor, we'll be right out. We never get to see the doctor. In, I would say, less than 20% of the cases, we have a one-on-one with the physician. So there is no chain of custody with that document. We don't know who's writing it, who's procuring it, and its dubious origin is being passed on to financial institutions, insurance companies. I don't want you guys to shoot the messenger. We're only here bringing you the true day-to-day operations of what's going on in the street. And that's why we're here today testifying. Is we're fully in support of Steve's, in support of Dr. Schwartz's presentation to lower the numbers, but we feel it should go all the way down to 0, that it should be mandated that every physician participate in the program. And we appreciate the fact that he's given consideration to Section 207 about eliminating the fees. We're more than willing to help the city track these remains, which not only is a problem for us, it's a problem for your own chief medical examiner. Many of these smaller institutions don't have mortuary facilities, and they routinely pick up the phone and assign the case to the medical examiner's office because they're unable to provide custodial care. That process is overwhelming the medical examiner's office. We have brand-new facilities that they're spending millions of dollars on to build, and they don't have a $5,000 mortuary holding machinery inside the building. It's created a situation where the medical examiner is overwhelmed and they're losing track of their accuracy, is the word I'll use. Remains that are collected in the Bronx from nursing home facilities and are unclaimed. The facility becomes overloaded, they need to transfer them out to Queens. When Queens becomes overloaded, they go out to the Bronx. These remains shift from county to county. I can only imagine the expense that the city is incurring at the appreciation of these private medical facilities. This has to stop. The medical facilities have to put mortuary facilities in their building so that the physicians have time to complete the death certificates, take the pressure off the medical examiner's office, and create a situation where the remains are treated with a little more dignity than just pieces of a puzzle that's shipped all around the city of New York, which is what's happening right now. In conclusion, I guess we talked about all the high points here. In conclusion, it's just, I'm saying that right now it's in the hands of this committee to close the stopgap or create a stopgap on what's going on out in the street. There's things that we've been witness to, and we've informed Dr. Schwartz today. We just had a little sidebar, we were speaking about things, and he was unaware of the situations that we're exposed to on a daily basis. But that's why we're here today, is to bring this information to you and say that at this point in time, we're in favor of everything, but the numbers should be reduced down to zero. Should be mandatory usage by all parties. And that concludes. Gentlemen, did I forget anything? I don't know the formality of this, Mr. Ron, what do I?
No, actually, sir, that's, if you have nothing else to say, then that concludes your
That's it?
testimony. Generally, these hearings are not supposed to be interactive. They're essentially one way.
Mhm.
The public tells the department what their concerns are, and then the department takes those concerns and passes them on to the Board of Health for their consideration and their action.
Okay,
So, I thank you.
thank you.
I am not aware of any other individuals or firms who have registered to speak. So at this point, I will adjourn this public hearing until approximately 3:55 p.m. This hearing is scheduled to go up until 4 p.m. And as I said, we will re-adjourn until 3:55, at which point, if anyone else has registered to speak, we will be happy to listen to them. Hearing is now adjourned. Thank you.
Thank you, Mr. Ron.
Thank you.
And the committee.
All set? All set? Great. Okay, good afternoon. I am Harminder Paul Rana, Assistant General Counsel for the New York City Department of Health and Mental Hygiene. Joining me again is Dr. Stephen Schwartz, Registrar for the City of New York, and Svetlana Burdanik, Assistant to the Secretary of the Board of Health. We were adjourned from earlier. This public hearing began at approximately 2 p.m. It is scheduled to run until 4 p.m. We had adjourned after the initial speaker had presented his testimony. We had said that we would re-adjourn to 3:55 or approximately therein, and unless a individual presented themselves to speak and registered to speak, and in fact, we do have an additional registered speaker who I will now introduce and allow to testify. And that individual is, and again, forgive me if I mispronounce your name, Rosalind Riggins Howard.
Yes.
President of Empire Funeral Directors Association. Ms. Howard, this is a public hearing, so it is an opportunity for you to present your testimony. to the department. The department will note down your testimony, and we have recordings of it, and we will pass this information on to the New York City Board of Health, who has the authority to make this change that the department is proposing. I will summarize again what this proposal is. The department has asked the board to amend certain sections of the health code, specifically sections 205.03 and sections 207.13, to increase the number of users who are required to submit electronic death records, and to eliminate the fees charged for interim disposition permits and for correcting a final disposition as a result of an interim disposition, respectively. So, Ms. Howard, please feel free to speak.
Yes, thank you. Good afternoon.
Please, microphone.
Yes, thank you. Good afternoon. As I'm here in support of Metropolitan Funeral Directors Association and their testimony, I would say for the first proposal, to amend it to increase the number of users that are required to submit electronic death records. If it was mandatory, where all hospital facilities, nursing facilities, doctors in their private practices, if the whole system was electronic, we wouldn't have some of the problems with a paper certificate, such as the death certificate being rejected from the health department because of the doctor, with all due respect, not filling it out properly, the color of ink, little detail that will cause the death certificate to be rejected. Also, it would eliminate a lot of fraudulent activities if it's mandatory that all death certificates are electronically submitted. That's for the first proposal. As for the second proposal, as with MetLife, we're in full support. I did call, I don't know if I should stop and put this off the record. I do have a question.
It's up to you.
Okay. For an interim disposition permit, there's no fee for the interim disposition permit.
There is now.
There is now.
And Dr. Schwartz is asking the group, the health department, to eliminate it for us,
Okay.
so that we would use that interim permit more frequently when we have remains that final disposition hasn't been determined yet.
Okay. Yes, thank you.
Are we back on the record now?
Yes, we're back on the record.
We're back on the record.
Thank you. And the second proposal, not to be repetitive, we're in full support as the Metropolitan Funeral Directors Association. Thank you.
Okay. Does that conclude your testimony?
Yes.
Okay, thank you, Ms. Howard. I don't believe there are any more individuals who have registered or otherwise expressed a desire to speak. The time is 3:56, and I will, I guess, adjourn for possibly 4 more minutes until the scheduled completion time of this public hearing arrives at 4 p.m. Thank you.
Thank you.
And we're
Thank
adjourned.
you. You didn't want that was painless?
Yeah, it was painless, but I still felt kind of awkward, like.
Well, that's okay because we started technically 12 minutes past 2.
A lot of people are talking about that.
Okay. Okay, we're back on. All right, good afternoon again. I'm Mr. Rana, accompanied as always by Mr. Dr. Schwartz, the registrar for the City of New York, and Ms. Burdanik, the assistant to the Secretary of the Board of Health. It is now 4:06 p.m., and I am officially closing this public hearing. Thank you.